I hate to make you all sit down again. It's the end of a wonderful and long day. I really, this is called the low carbohydrate panel. I'm Ellen Goodman. I'm a recovering journalist. And I realize that is a category that was not asked about early this morning. But there are actually two of us on this panel who are recovering journalists, as they say. And I realize that these wonderful conversations today have been largely about your work as professionals, as clinicians, as healthcare providers, as community leaders, but also, and very importantly, everybody here is here as a mother, as a father, as a spouse, as a friend. Every one of us has had a pretty profound experience that leads us to the work we are doing to get the person. You will notice that I did not say the patient, to get the person's voice into the room. And we are also here as change agents. And that's a word that I probably haven't really heard enough of today, even though all of us are change agents. And our panel is really about change, about seeing ourselves as change agents, as people who are driven to figure out some new and successful ways of engaging people in their own care, and also stepping into the public space, because this panel is really getting one step further out and really engaging the public. For that purpose, we have a very powerful panel of change makers. I'll introduce them briefly, then tell you some more about the Conversation Project. Nick Jalen is here. He's a partner in Common Practice, and he'll talk about all kinds of tools, fun tools, even games, like My Gift of Grace and Hello, that encourage conversations. Rebecca Sidora, many of you know, she's at the University of California, San Francisco, and her work with Prepare is really for upstream care planning with easy-to-read advanced care planning directives. Joy Buck is here from the West Virginia University School of Nursing, when she does research on living and caring with people with serious illness. And Peter Mitchell, the other recovering journalist, is chair of Slater Mitchell, who does behavior change marketing. So that's where we are. Before you hear from them, I've also been asked to talk as a change agent myself, as a founder of the Conversation Project, a public engagement campaign to see that everyone's wishes for end-of-life care are expressed and respected. Two parts, expressed and respected. We began our work, I have to tell you that we began our work right in the face of death panels. Nobody has mentioned that today, but a lot of us remember that as our own kind of baseline of work. And we began that work with a theory of change. Our theory of change was built on other social changes and on a very deep recognition that we needed to listen to and to engage people who had stories that had never been aired or shared, who were living often with the pain of being survivors, unsure about whether they had done the right thing for the people they loved. A very tough thing to live with. So we believed in what I've come to call a double helix of social change, and you will forgive me because I am not a biologist at all. That idea is that change has to come from the outside, from the community, be brought into institutions where it is accepted and kicked up a notch, sent back out into the community, and then brought back into the institutions as well. So there's a relationship between the world in which this work is going on outside of hospitals, outside of healthcare, and the support for that work, and what's happening inside the healthcare system. So what we wanted to do first was to literally get people to the proverbial kitchen table to talk about their wishes, their values, how they wanted to live with the people they loved and to do it before there is a crisis, because as we all know, a crisis is a terrible time to learn. We recognized right from the beginning that many people, when they start these conversations, need something to hang on to. They need a security blanket, they need a script, they need some kind of outline. And so we created tools that were not medical, and they were not scary. They did not have an endless checklist of procedures. They were about values. They were about what matters to you and not what is the matter with you. So these are some of our toolkits that we have so far. Our conversation starter kit, which has been translated pretty widely and has been used by about 1 million people now. We then have a kit called How to Talk to Your Doctor. Subtitle, I say, only slightly snarkily, because your doctor's not going to talk to you. We then have a kit for parents of seriously ill children, and that's been helped enormously by people like Blythe. And then we had a kit that we released last spring for families and loved ones of people with Alzheimer's disease and other forms of dementia. And that was because people really felt that they needed that. And it was also, I say, of great personal and tender importance to me, because my sister died of Alzheimer's disease 4 years ago. And we also recognized very quickly after that we had to bring the conversation project to people where they live, where they work, and where they pray. And I have to be honest and say that we didn't quite recognize that. People came to us and they asked us to bring the conversation project. And we did not expect to be in the field organization. We're still a fairly small organization, but what we said was that we could help. They knew their own communities best, but we could help them get started. We could keep them connected and help them. And today we have about 400 people in groups in 44 states who are working with the Conversation Project. We created a faith initiative for a variety of reasons, some of which you've heard from faith leaders today. First, serious illness is a spiritual crisis, not just a medical crisis. Second of all, people turn to their religious communities when they are in all kinds of crises, and they turn to communities where they are known, where they experience trust, where they find comfort. And these communities often represent underserved groups, and that's a very important outreach for us, for people who are less likely to have had the conversation or signed advance directives. And also, which hasn't been confessed today, we went to faith communities because, to be quite honest, faith leaders have no more training in having these conversations than doctors. So these faith leaders are called on in spiritual crises, and quite frankly, they often don't know what to say either. And so we reached out to them for those reasons too. We also brought the Conversation Project to some places that don't seem like natural allies at first, to the business world and to financial planning world, where estate planners and financial planners are those people we've often had. Many of us have had that experience of signing your estate plan, and while you're doing it, he kind of shoves a piece of paper across the desk and says, oh yeah, sign this, who's your healthcare proxy, and you go, okay, and you sign it, but nobody said the conversation, nobody knows what it means. So, and they're aware of that too, so we've been working in that world as well. And probably most fundamentally, what the Conversation Project has done is to bring the stories and to bring media attention to these issues, and also to create a PSA campaign. Every meeting that many of us have been at talks about the importance of a public engagement campaign, and yet it keeps getting to drop to the bottom of the list. And it never quite happens. So what we did was we designed and tested and then piloted a PSA campaign on the subways in Boston. And then we went to the dark side and put it into Facebook pop-up ads. I confess that to you. And by the way, the Facebook pop-up ads, for the time that we were out with them, increased our traffic to our website 200%. So this is one of the PSA, this is the one that turned out to be the most popular one, interestingly enough. And it may be because I like this saying, some things should not go unsaid. How simple is that? When it comes to end-of-life care, talking matters, and the campaign hashtag was talking matters. We emphasize early conversations because we are not just talking about dying, but as many people here have said today, we are talking about living well all the way to the end. And also, we emphasize early conversations because we did a survey over 2 years ago now that showed that 90% of Americans think that these conversations are important. And if I can channel Amy, 90% of Americans don't agree on anything. They don't agree on the national anthem. So the fact that they agreed that these conversations were important was extraordinary, and yet only 30% had had them. And when we asked why they hadn't had them, the first reason that they said was because it was too soon. So we always say, it's always too soon until it's too late. Finally, I have to say that we have a new tool that we are releasing in January. And one of the most important things that we all know needs to be done in this work is to find out who can speak for you if you cannot speak for yourself, a healthcare proxy. So we have put together a brief kit, a small, simple, again, very user-friendly kit called How to Pick a Decision Maker, How to Be a Decision Maker. Actually, we call it How to Pick a Healthcare Proxy and How to Be a Healthcare Proxy. And we're trying to figure out some simple way to describe to the public what proxy actually means. But we're still working on that one. This is just the beginning, but what we want you to take away from our last panel today is the critical, absolutely fundamental need to engage with the public, because if we don't engage with the public, none of what we're doing is going to work, and to find new and innovative ways to listen and encourage people to share their values and to have them respected. We need that voice of the community going in, as well as the responsiveness of the healthcare clinician community. That's the way change happens. So our first change agent today, I don't have to do their entire bios because they are in your packet, but our first change agent today is Nick Jalen, co-founder of Common Practice.